Very good afternoon, students. Today I will explain regarding the pain. It is the 14th unit of the nursing foundation subject. So let us see the pain. In everyday of life, sometimes we or you feel pain. So that pain is very unpleasant, and at the time of the pain, feeling of pain, we feel sensory experience as well as the emotional experience, and that will result from the actual or real potential or possibility to doing the tissue damage. From that result, we feel sensory or emotional experience, and that is a sensory or a sensory pain experience or emotional pain experience. Okay, so definition of pain is the pain is unpleasant sensory or emotional experience associated with the actual or potential tissue damage or described in terms of such damage. So that we know that pain is unpleasant. It is discomfort to the individual or patient feel the discomfort during the pain, so it is unpleasant. And during the pain we feel sensory experience and as well as the emotional painful experience. Okay, so sensory painful experience as well as the emotional painful experience will be realized or the feel that is a result from the actual or potential tissue damage. So sensory painful experience is that due to it will be happen due to the our sensory receptor present in the under the skin, and sensory nerve endings also present under the skin, so that what of the injury result that outside stimulus outside injury stimulus that will be transferred through the sensory receptor and or as well as the nerve ending towards the brain. Okay, then brain send the message that by which person feel pain. Okay, so it is the sensory experience because our sensory receptors nerve endings present under the skin tissue, so these are the gives response towards the outside stimuli which causes the damage to the tissue. And we also feel painful emotional experience such as we become sadness, upset, and we feel sadness or upset due to the situations. Okay, so that situations, memories or experience that becomes painful, and when it becomes painful, that is very difficult and unpleasant to the patient to deal with. Okay, and it is make you feels very sad and upset. So situation, memory and experience from that area, if that area becomes unbalanced, so that a painful experience will be felt by the persons, and it is very difficult to deal with the situations. Okay, at that time person feel very sadness and becomes upset. Our emotional experience like the fear, love, anger, hatred, all are caused by the situations. According to situations, person become fear. According to situations, person love with others, gives love and affection towards others, and also receive the love and affection from others. A person becomes anger also. And these sensory or emotional experience result from the actual tissue damage, real tissue damage. Persons directly tissue damage occurs, and potential tissue damage, that tissue damage will be occur or it will be remains for prolonged period of time. Okay, and possible to becoming the damage. So from that situations or from that damage of the tissue damage, persons feel the sensory painful sensory experience like the he becomes their facial experience will be changed. Okay, and persons becomes the area will becomes redness, okay, and the person feels the mild, moderate, severe types of pain. And in the painful emotional experience, person will be feel at that time persons becomes the fearness, becomes anxiety, okay, and becomes weariness, okay, and persons feel very painful situations which is very difficult to deal with the situations. ତାହେଲେ ପେନ୍ ଆମେ ବୁଝିଲେ କ'ଣ ଜାଣିଲେ ନା ପେନ୍ ହେଉଛି ଗୋଟେ ଅନପ୍ଲିଜେଣ୍ଟ ଏହା ଡିସ୍କମ୍ଫର୍ଟ ଟୁ ଦ ପେସେଣ୍ଟ, ଅନପ୍ଲିଜେଣ୍ଟ ଡିସ୍କମ୍ଫର୍ଟ ଦେଇଥାଏ ଏବଂ ପେନ୍ ଫିଲିଂ ସମୟରେ କ'ଣ ହୁଏ ପେନ୍ଟା ତ ଅନପ୍ଲିଜେଣ୍ଟ ଡିସ୍କମ୍ଫର୍ଟ ଅଟେ ଏବଂ ଯେତେବେଳେ ରିଏଲି ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ ହୁଏ ବା ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ ହେବାର ସମ୍ଭାବନା ମଧ୍ୟ ଥାଏ କିମ୍ବା ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ ଅଲରେଡ଼ି ହୋଇସାରିଛି ତ ହୋଇସାରିଲା ପରେ ଆମର କ'ଣ ହୁଏ ନା ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ ସମୟରେ ଓକେ ଡ୍ୟୁରିଂ ଦ ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ due to the presence of the sensory receptor and nerve endings under the skin muscle ଯେତେବେଳେ ଟିସ୍ୟୁ ଆମର ବଡ଼ି ଇଞ୍ଜୁରି ହୋଇଯାଉଛି ସେହି ସମୟରେ କ'ଣ ହେଉଛି ନା ଆମର ଯେଉଁ ସ୍କିନ୍ରେ ଅଛନ୍ତି ନର୍ଭ ଏଣ୍ଡିଙ୍ଗସ୍ ଗୁଡ଼ା ରହିଛନ୍ତି ସେନ୍ସରି ରିସେପ୍ଟର ଅଛନ୍ତି ସେମାନେ କ'ଣ କରନ୍ତି ନା ଷ୍ଟିମୁଲିକୁ କହନ୍ତି ଇଞ୍ଜୁରିୟସ୍ ଷ୍ଟିମୁଲସ୍କୁ ନେଇକି ଆମ ବ୍ରେନ୍ ପାଖରେ ପହଞ୍ଚିଥାନ୍ତି ତାପରେ ବ୍ରେନ୍ ମେସେଜ୍ ଦେବା ପରେ ଆମକୁ ପେନ୍ ହେଉଛି ବୋଲି ଆମେ ଜାଣିଥାଉ ଓକେ ତାହେଲେ ଏଥିରେ ସେନ୍ସରି ଏକ୍ସପିରିଏନ୍ସ ଇଣ୍ଡିଭିଜୁଆଲ୍ ଫିଲ୍ କରିଥାଏ ପେନ୍ ସମୟ ଯେତେବେଳେ ପେନ୍ ହୁଏ କାହିଁକିନା ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ ହେଲା ପରେ ଏବଂ ଇମୋସନାଲ୍ ଏକ୍ସପିରିଏନ୍ସ ମଧ୍ୟ ଫିଲ୍ କରେ ପେସେଣ୍ଟ ଅପସେଟ୍ ହୋଇଯାଏ ଏବଂ ସାଡନେସ୍ ହୁଏ ଫିଅର୍ ହୋଇଯାଏ ଓରିନେସ୍ ହୋଇଯାଏ ଏଇଟା ପେନ୍ଫୁଲ୍ ଇମୋସନାଲ୍ ଏକ୍ସପିରିଏନ୍ସ ମଧ୍ୟ ଫିଲ୍ କରେ ଯେହେତୁ ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ ହେଉଛି ଓକେ ଦେନ୍ କମ୍ ଦ ନେଚର୍ ଅଫ୍ ପେନ୍ Pain is subjective and highly individualized. When individual say that he or she feels pains at the time, we know that person feels pain. ଯେତେବେଳେ ଇଣ୍ଡିଭିଜୁଆଲ୍ କହୁଛି ଯେ ତାକୁ ପେନ୍ ହେଇଛି ସେତେବେଳେ ଆମେ ଜାଣିଲେ ସେ ପେନ୍ କଣ୍ଡିସନରେ ତାକୁ ବର୍ତ୍ତମାନ ପେନ୍ ଫିଲ୍ ହେଉଛି ବର୍ତ୍ତମାନ ସେଥିପାଇଁ ସେ ଓରି ହେଇଯାଉଛି ଆଙ୍ଗଜାଇଟି ଫିଲ୍ କରୁଛି ଏବଂ ସେ ଟେନସନ୍ ଷ୍ଟେଜ୍ରେ ରହିଛି ଏବଂ ଇଟ୍ ଇଜ୍ ଇଣ୍ଡିଭିଜୁଆଲାଇଜଡ୍ ହାଇଲି ଇଣ୍ଡିଭିଜୁଆଲାଇଜଡ୍ ଏହା ଇଟ୍ ୱିଲ୍ ଅକର୍ ଟୁ ଦ ଇଣ୍ଡିଭିଜୁଆଲ୍ ଓକେ personality occur to the individual to individual is differ the pain levels will be different from individual to individual so some individual feels very do not tolerate to the pain some individual tolerate to the pain okay so that when individual say that he or she suffers from the any type of injury and feel pain at that time nurse or doctor know that patient has pain she feels discomfort okay when person says that he has pain conditions and he feel discomforts and also we see that pain is present at the time we were confirmed that patient also really feel pain and it is also known by the facial expressions and by knowing about that there any type of disturbance in the figure in the gesture posture okay so for that we know that patient feel the pain and during severe pain patient becomes crying so that ଯେତେବେଳେ ପେସେଣ୍ଟ କହୁଛି ଯେ ପେନ୍ ତାର ହେଉଛି ଏବଂ ଆମେ ଦେଖୁଛୁ ଯେ ପେସେଣ୍ଟ ପେନ୍ କଣ୍ଡିସନରେ ବର୍ତ୍ତମାନ ରହିଛି ତାହେଲେ ସେତେ ଜାଣିଲେ ଯେ ବର୍ତ୍ତମାନ ପେସେଣ୍ଟ ଯାହା କହୁଛି ତାହା ସତ ଅଟେ ଏବଂ ପେସେଣ୍ଟକୁ ପେନ୍ ହୋଇଛି ଆଉ ପେସେଣ୍ଟ ବର୍ତ୍ତମାନ ପେସେଣ୍ଟକୁ ଡିସ୍କମ୍ଫର୍ଟ ଫିଲ୍ ହେଉଛି ପେସେଣ୍ଟକୁ ପେନ୍ ହେଉଛି ଓକେ either it is will be patient को abdominal cramp होइछि किबा कैंसी सर्जरी प्रोसीजर रे after surgery procedure patient also has in the pain okay during the labor pain okay labor pain during the delivery times before delivery sometimes the pains also feels by the woman okay during the pain we cannot able to talk with other persons cannot make friendships and unable to take work, any work. So our personal it will hamper to the or interfere to the personal relationship. Okay, and it also influence our meaning of life. So in the life, whatever you do, that is like the any type of enjoyment, any type of homework, any type of office work, so all work will be stopped during the feeling of the pain. Only patient who feels pain, he or she is known better than others. Okay, and location of pain also be he will be determined, and also be said which type location of pain, intention of pain. All the things are also be explained by the individuals. Okay. It is may not be directly proportional to the amount of tissue injury. How much tissue injury will there, according to it, pain also not feel. Pain feels according to the area which is more sensitive, and that area will be more affected. From that, the pain will be felt by the persons. তাহলে and the stimulus which is causes the tissue damage or by which person feel pain, it is either physical or mental nature. Okay, physically will feel pain by the tissue damage, and mentally will be disturbed, and emotional experience will feel like the sadness, upset, anger, fear, etc. ତାହେଲେ ବ୍ୟକ୍ତି ଯେତେବେଳେ କହୁଛି ମୋତେ ପେନ୍ ହେଉଛି ଏବଂ ଆମେ ଦେଖୁଛେ ତାକୁ ସେ ପେନ୍ କ'ଣ ପେନ୍ ପ୍ରେଜେଣ୍ଟ ପେନ୍ ପେସେଣ୍ଟ ବଡ଼ିରେ ପ୍ରେଜେଣ୍ଟ ଅଛି, ସେତେବେଳେ ବ୍ୟକ୍ତିକୁ ଆମେ ଜାଣିଲେ ଯେ ପେନ୍ ହେଉଛି। ଏବଂ ଏହା ହେଉଛି ସେଥିପାଇଁ ଏହାକୁ ସବଜେକ୍ଟିଭ୍ କୁହାଗଲା। ଯେହେତୁ ପେସେଣ୍ଟ କହୁଛି ଯେ ମୋତେ ପେନ୍ ହେଇଛି, ତେଣୁ ସବଜେକ୍ଟିଭ୍ କୁହାଗଲା। ଏବଂ এই স্টিমুলাস जो आउटसाइड स्टिमुलस बॉडी पर जो अफेक्ट पकाए ता फिजिकाली बा मेंटल नेचर होता है। फिजिकाली हिसाब से टिश्यू डैमेज होता है और मेंटली भाव में से इमोशनल डिस्टर्बेंस हुए, फियर आंगर एंजाइटी कंडीशन रे रही है। एवं ये पेन कौन जो पेसेंट पेन हुए से तार कौन सहित रिलेसन ठीक रखिपार ना, एवं एथर केवल पेसेंट जाने जे केते परिमाण में कौटी पेन होची। एवं आम टिश्यू इंजरी पर पेन फिल करे ना, ऑर्गन्स एरिया अनुसार पेन माइल्ड टू सिवियर कंडीशन पर्यंत होता है। ओके, नेक्स्ट कम द साइन एंड सिम्पटम्स पेन। ड्यूरिंग द पेन, रेस्पिरेटरी रेट will increase, pulse rate increase, heart rate also increase, and peripheral vasoconstriction occurs. Blood vessel becomes constricted and increase the BP, increase blood glucose level, and person becomes excessive sweating during the feeling of pain, and people becomes dilated. Okay, then come to the types of pain. According to origin of a pain, there is 3 types of pain, like the cutaneous pain, somatic pain, visceral pain. In the cutaneous pain, that pain arises from the skin and the subcutaneous tissue. After cutting of the skin and the subcutaneous tissue, the pain the persons feel pain, and that pain results from the cutting of the skin and the subcutaneous tissue, and that pain is a very sharp pain. Okay, next come to the somatic pain. When an injury occurs in the ligaments, tendon, blood vessels, and the nerves, the person has pain, and the person rises pain from injury of the that organs, like the blood vessels, injury of the blood vessels, nerves, ligaments. Example of the ankle pain, ankle pain, sprain. ଯେତେବେଳେ ଆମର କ'ଣ ହେଉଛି ନା ଆଙ୍କଲ ଜାଗାଟା, ଆଙ୍କଲ ଯେଉଁ ଗୋଡ଼ର ଆଙ୍କଲ ଅଛି ସେ ଜାଗାଟା ଯଦି ମୋଡ଼ି ହେଇଯାଉଛି, ତ ସେଠି କ'ଣ ଅଛି ଲିଗାମେଣ୍ଟ ଟେଣ୍ଡନ୍ ସବୁ ଅଛନ୍ତି, ବ୍ଲଡ଼ ଭେସଲ୍ ବି ଅଛନ୍ତି। ତ ଯଦି ଆଙ୍କଲ ଜାଗାଟା ମକଚି ହେଇଯାଉଛି ବା ମୋଡ଼ି ହେଇଯାଉଛି, ସେତେବେଳେ ଆମେ ପେନ୍ ଫିଲ୍ କରୁ। ସେଇ ପେନ୍କୁ ସୋମାଟିକ୍ ପେନ୍ କହନ୍ତି। ଏହା ଏକ ସୋମାଟିକ୍ ପେନ୍ର ଏକ୍ଜାମ୍ପଲ୍ ଅଟେ। ତ ସୋମାଟିକ୍ ପେନ୍ସ ରେଜଲ୍ଟସ୍ ଫ୍ରମ୍ ଦ any injury occurs in the ligament, tendon, blood vessels, and nerves. Example is the ankle sprain. Okay, next come to the visceral pain. Sometimes persons feel the abdominal cramping, throbbing, arches, etc. So the any person feel pain that result from the any injury of the abdominal cavity, cranium, thorax, or any pains comes from the abdominal cavity, cranium, thorax, from any regions, the person feels that which type of pain, that is known as the visceral pain. তাহলে abdominal cavity हो, cranium हो, thorax हो, कौन सी रीजन हो बा इंजुरी जो इन्फेक्शन जो पेन क्रिएट है, से जो पेन क्रिएट है से जो व्यक्ति abdominal cavity, cranium thorax रे जो टाइप रो पेन क्रिएट है, कौन सी इंजुरी हो बा कौन सी कॉज जो हो, तो से पेन को visceral पेन कही था. Here persons progress to the ischemic condition, and persons has the muscle spasm, muscle becomes constricted at the time of the feeling of the visceral pain, because visceral pain result from the pain receptor present in the abdominal cavity, cranium, thorax. So that pain arises from the abdominal cavity, cranium, thorax, that type pain known as visceral pain. ताल pain जो abdominal cavity, cranium, thorax रू create होला ताको visceral pain कहता हूँ. At that time patient has the abdominal cramping, throbbing, okay, and arches in the abdominal area. According to pain resistance, that is acute pain, chronic pain. Acute pain it is lasting for 2 to 6 months. It is short time duration. Example of the acute pain is the any type of recent disease, any type of infection, inflammation, surgical procedure, any type of injury. Okay, this is the example of patient feel pain from the that type of procedure, disease, or injury. In the chronic pain, that pain remains prolonged period of time, that last for 6 months to the week, day, and month, and it is very longer, and it will interfere the functioning of the body part. So according to pain resistance रे दुटा टाइप विभाग करागला, acute pain, chronic pain. In the acute pain it is the short term durations, it last for the 2 to 6 months. Okay, in the acute pain persons feel acute pain, or acute pain result from the any type of infection, injury, from any type of surgical procedures, etc. And the chronic pain that is exist in the body from that is last through the 6 months, and it is remains prolonged period of time, and is very longer, and it interpreted the function of the body part. Then the further classification as a chronic malignant pain. Then the point number C, the pain also classified in the chronic malignant pain, that is known as the cancer related pain. When the tumor will become progressive, and patients has become soreness. Okay, patients become fear towards the for the diagnosis of the cancer, and there the injury inflammation process go ahead, so that during the cancer, that is due to the progress of the tumor, patient feel the pain. And persons also fear pain during the cancer, that persons has the fear to death, so that the cancer related pain occurs, and it is very harmful to the patient. Okay, ताले कैंसर रेट पेन कौन ना व्यक्तिर कैंसर समय तार ट्यूमर प्रोग्रेस हो जाए, व्यक्तिर इन्फर्मेशन इन्फेक्शन कंडीशन रे सब रही थाए, केमोथेरापी रिसीव करि थाए. ओके, एवं व्यक्तिकर मरी जबार एक फियर रही थाए, डेथ हबार फियर रही थाए, तेणु ये सब से पेन फिल करे, ताको कहते हम कैंसर रेट पेन. ओके, नेक्स्ट फैक्टर इन्फ्लुएंसिंग पेन. There is 5 factors, like the first is the development factor, and next is the physiological factor. Under the physiological factor, there is fatigue, genes, neurological function. Under the social factor, there is attention, previous experience, family and social support. Spiritual factors. In the psychological factor, that is anxiety, coping style, and coping style. Then last is the cultural factors. So in the development factor, first is the age. Age also influence to the pain. So child or the infant do not understand properly about the pain because they are unknown about it. Okay, so then they cannot be expressed verbally about the regarding the pain, so that and do not express the pain towards the parents and caregiver, so that age also influence to the pain. So age also affected by the pain. Age influences by the pain, so that that infant and young adult cannot be expressed verbally to the parents regarding the pain, so that due to the pain they feel uncomfort and also progress towards the chronic stage. Okay, because they have not developed the full vocabularies, then cannot express their language regarding the intensity of the pain, location of the pain, etc. Next come to the fatigue. So fatigue, that is influenced by the pain. Pain will affect to the fatigue during the fatigue stage. During the fatigue time, patient becomes very tired, and the highest perception of pain will be appear, and the person has the persons reduce their the adjustment capability to the situations. Okay, if the persons cannot take rest, then the pain levels progresses, pain level increases. Okay, and pain will be experienced if patient take rest, then pain the experience of pain will be reduced. ଯେତେବେଳେ ଫ୍ୟାଟିକ୍ ମଧ୍ୟ ବା ଟାୟାର୍ଡ଼ନେସ୍ କହନ୍ତି, ତ ଫ୍ୟାଟିକ୍ ବା ଟାୟାର୍ଡ଼ ବ୍ୟକ୍ତି କ୍ଳାନ୍ତ ହୋଇଥାଏ, ତ ସେ କ୍ଳାନ୍ତ ହେଲା ସମୟରେ ବ୍ୟକ୍ତି ହାଏଷ୍ଟ ପେନ୍ ରିସିଭ୍ କରିଥାଏ, ଏବଂ ଯେତେବେଳେ ସେ ସ୍ଲିପ୍ ଯଦି ସେ ଠିକ୍ ଭାବରେ ସ୍ଲିପ୍ ନ କଲା ତାହେଲେ ତାକୁ ଅତ୍ୟଧିକ ପେନ୍ ହୋଇଥାଏ, ଯଦି ସ୍ଲିପ୍ କରିଦେଲା ତାହେଲେ ଡେ ଲାଷ୍ଟରେ ତାକୁ କିଛି ରିଲାକ୍ସେସନ୍ ମିଳିଥାଏ. Next come the gene. The research, it is found that genetic information passed from the parent to their child, and increases or decreases a person's sensitive to pain, it determine the genes. Okay, ତ ବ୍ୟକ୍ତି କେତେ ପରିମାଣ ପେନ୍ ଫିଲ୍ କରୁଛି ଯଦି ତା ପ୍ୟାରେଣ୍ଟସର ଯେଉଁ ଟାଇପ୍ର ରହିଛି ତ ଚାଇଲ୍ଡକୁ ମଧ୍ୟ ଟ୍ରାନ୍ସଫର୍ ହୋଇଯାଏ. Example, strengthness of the persons and the any type of disease present in the parents or weakness of the parents, that strengthness or talented or the any type of hereditary disease present in the parent, that will be transferred to the child, so that a child also feels same pain like the parents. During the any hereditary disease will be transferred that from that disease, the person always feels pain. So it is a one type of example of the genetic factors influence to the pain. It is transferred from the parents to their child. Example is the filaris conditions. The parents failure ହେଇଛି ତାହେଲେ ଛୁଆମାନଙ୍କୁ ମଧ୍ୟ failure ହେବାର ବହୁତ ଚାନ୍ସ ଅଛି. AIDS is also another disease that will be that disease also will affect to the child, where the child becomes feel very weak. But due to the gene transformation, if the parents very weak and parents have certain inherited disease, that will transfer to the next generation, their child also feels same type of weakness and pain like their parents. ତାହେଲେ ପ୍ୟାରେଣ୍ଟସ୍ ଠାରୁ ମଧ୍ୟ ଜିନ୍ ଟ୍ରାନ୍ସଫର୍ ହୁଏ ଛୁଆମାନଙ୍କ ପାଖକୁ. ଯଦି ପ୍ୟାରେଣ୍ଟମାନଙ୍କର କିଛି ଇନହେରିଟେଡ୍ ଡିଜିଜ୍ ଅଛି, ହେରିଟେଡ୍ ଡିଜିଜ୍ ଅଛି, ବଂଶଗତ ଡିଜିଜ୍ ରହିଛି, ସେଇ ପ୍ୟାରେଣ୍ଟସ୍ର ସେଇ ଡିଜିଜ୍ ଯୋଗୁଁ ସେ ଯେଉଁ ଟାଇପ୍ର ୱିକନେସ୍ ଫିଲ୍ କରୁଛନ୍ତି, ପେନ୍ ଫିଲ୍ କରୁଛନ୍ତି, ମଧ୍ୟ ଛୁଆମାନଙ୍କୁ ସେଇ ଟାଇପ୍ର ହୋଇଥାଏ. ନେକ୍ସଟ କମ୍ ଟୁ ଦ ନ୍ୟୁରୋଲୋଜିକାଲ୍ ଫଙ୍କସନ୍. any factor that will affect to normal pain receptor present under the skin or in the organs that affect the patient's awareness regarding the awareness of surroundings and also respond to the pain. So in the neural function, we learned that any factor that will be influenced or affected to the pain reception area, pain reception tracts. Example is the spinal cord injury that will be affect to the patient's awareness about their surroundings and also respond to the external stimuli, external pain stimuli, etc. ତାହେଲେ ଏଥିରୁ ଜାଣିଲେ ନା ନ୍ୟୁରୋଲୋଜିକାଲ ଫଙ୍କସନ୍ ମଧ୍ୟ ପେନ୍ ଯୋଗୁଁ ଆଫେକ୍ଟ ହେଉଛି। ଏକ୍ଜାମ୍ପଲ୍ ଆମର ପେନ୍ ରିସେପ୍ଟିଂ ଟ୍ରାକ୍ସ ବା ପେନ୍ ରିସେପ୍ସନ୍ ଏରିଆ ହେଉଛି କେଉଁଟା ନା ଆମର ହେଉଛି ସ୍ପାଇନାଲ୍ କର୍ଡ଼, କାରଣ ସ୍ପାଇନାଲ୍ କର୍ଡ଼ ଦେଇକି ହିଁ ବ୍ରେନ୍କୁ ପେନ୍ ଷ୍ଟିମୁଲି ଗୁଡ଼ାକ ଯାଇଥାଏ ଏବଂ ନର୍ଭ ଷ୍ଟିମୁଲି ଗୁଡ଼ାକ ଯାଇଥାଏ, ତାପରେ ପେନ୍ ଫିଲ୍ ହେଲା ବୋଲି ବ୍ରେନ୍ ମେସେଜ୍ ଦେଇଥାଏ। ତ ଯଦି ସ୍ପାଇନାଲ୍ କର୍ଡ଼ ଇଞ୍ଜୁରି ହୋଇଗଲା ତାହେଲେ କ'ଣ ହେଲା ନା ଟୋଟାଲ୍ ସ୍ପାଇନାଲ୍ କର୍ଡ଼ ଆଫେକ୍ଟ ହେଲା ପରେ ବ୍ୟକ୍ତି ତା'ର ସରାଉଣ୍ଡିଂସରେ କ'ଣ ହେଉଛି ସେ ଠିକ୍ରେ ଜାଣିପାରେ ନାହିଁ। ହି ଇଜ୍ ଅନନୋନ୍, ହି ଇଜ୍ ନଟ୍ ପ୍ରପରଲି ଆୱାରନେସ୍ ଆବାଉଟ୍ ଦ୍ୟାଟ୍ ରେସ୍ପଣ୍ଡ ଟୁ ଷ୍ଟିମୁଲି। Next come to the social factor also affect to the pain, affected by the pain or pain influence to the social factor like the attention. So from the under the social factor, first attention also be diverted by the pain or influence of pain or perception of a pain, and when the person gives more concentration or attention towards a particular area which is the source of or origin of the pain, then patient feel more pain. Okay, if the at the time when if patient becomes a distraction conditions, he or she will become far away from the attention towards the other situations, then pain will be diminished or vanished. Attention, what is attention? Attention is the degree of the focus to the doing something. Okay, and degree to which the patient gives more focus towards the attention, that is known as the attention. Okay, so in the attention, the degree to which patient focus attention towards the pain influence or pain perception, that is known as attention. If the patient give the more attention towards the pain arising area, then patient gets more pain. If the patient diverted or distraction their attentions from the pain area to the other situations, then pain will be diminished or vanished. Okay, ଯଦି ଆମେ କ'ଣ ଯଦି କେଉଁଠି ଜାଗାରେ ଆମର ପେନ୍ ହେଉଛି ସେଇ ଜାଗାକୁ ଯଦି ଅଧିକ କନସେନ୍ଟ୍ରେସନ୍ ଦେବା ତାହେଲେ ପେନ୍ ଅତ୍ୟଧିକ ମାତ୍ରା ହୋଇଥାଏ। ଯଦି ଆମେ ସେଇ ସିଚୁଏସନ୍ରୁ ଓହରି ଆସି ଅନ୍ୟ କୁଆଡ଼େ ଆମେ ମାଇଣ୍ଡକୁ ସ୍ପେଣ୍ଡ କରିବା ତାହେଲେ ପେନ୍ ଲେଭେଲଟା ଧୀରେ ଧୀରେ କମି ଯାଇଥାଏ। Then come to the previous experience. When persons feel pain during the current situations, then he or she feel more discomfort through by the feeling of the pain. If the current pain is same like the previous pain, whenever patient feel pain in the past time where he will suffer same time of a pain, that pain will be resolved very easily because patient is know about that how pain will be resolved. Otherwise, without the past experience, persons feel more pain either if he or she well treated. A person having the roast the previous experience, he experienced much more pain. ତାହେଲେ ପ୍ରିଭିୟସ୍ ଏକ୍ସପିରିଏନ୍ସ ଯେଉଁମାନଙ୍କର ଥାଏ, ଯଦି କରେଣ୍ଟ ସିଚୁଏସନରେ ଯଦି କୌଣସି ଟାଇପ୍ର ଇଞ୍ଜୁରି ସେମାନେ ଇଞ୍ଜୁରି ତାଙ୍କ ବଡ଼ିରେ ହେଲା, ତ ଯଦି ଇମୋସନାଲି ସେମାନେ ମଧ୍ୟ ପେନ୍ ଫିଲ୍ କରେ କିମ୍ବା ଫିଜିକାଲି ମଧ୍ୟ ପେନ୍ ଫିଲ୍ କଲେ, ତାହେଲେ ସେଇ ପେନ୍ ଯଦି ପ୍ରିଭିୟସ୍ ଟାଇମ୍ରେ ଯେଉଁ ପେନ୍ ଫିଲ୍ କରିଥିଲ ତା ସହିତ କରେଣ୍ଟ ପେନ୍ ସେମ୍ ଅଟେ, କରେଣ୍ଟ ପେନ୍ ଯଦି ପ୍ରିଭିୟସ୍ ଟାଇମ୍ର ପେନ୍ ସହିତ ସେମ୍ ହେଲା, ସେଥିରୁ ଜଣାଗଲା ଯେ ସେ ପେନ୍କୁ ସେ ଠିକ୍ ଭାବରେ ରିଡ୍ୟୁସ୍ କରିପାରିବ, କାରଣ ପ୍ରିଭିୟସ୍ ୱେରେ ଯେଉଁ ଟାଇପ୍ର ପେନ୍ ହେଇଥିଲା ତାର କ୍ୟୁରେବୁଲ୍ଟା ସେ ଜାଣିଛି, ତ କରେଣ୍ଟ ସିଚୁଏସନରେ ତାହା ଆପ୍ଲାଏ କଲା ଏବଂ ପେନ୍ ଲେଭେଲ୍ କମିଗଲା। ଦେନ୍ କମ୍ ଟୁ ଦ ଫ୍ୟାମିଲି ଆଣ୍ଡ ସୋସିଆଲ ସପୋର୍ଟ। During the pain experience time, if family members and friends will be there, then your stress condition becomes reduced. You becomes the less stressful conditions, because family members, friends at the painful experience time, they give psychological emotional support and give it the care, so that person's pain will be reduced to some extent. Then comes the spiritual factor. When person experience or feel pain at the time, some spiritual questions comes the mind of the individual. Some individual tell to like that, why the pain happened, why am I suffering, and at last said that, why God gave me a much more painful situations. And it is either it is teaching given by the God to me for learning about anything. That type of talking comes the person's mind, and these questions and with answer, all are things come to the mind of the person during the person whenever he feel much painful. Okay, তাহলে ସ୍ପିରିଚୁଆଲ୍ ଫ୍ୟାକ୍ଟରରେ କ'ଣ ହେଉଛି ନା, ସାଧାରଣତଃ ସ୍ପିରିଚୁଆଲ୍ କୋଶ୍ଚିନ୍ ଯେତେବେଳେ ପେନ୍ଫୁଲ୍ ସିଚୁଏସନରେ ବ୍ୟକ୍ତି ରହୁଛି, ତ କିଛି ସ୍ପିରିଚୁଆଲ୍ କୋଶ୍ଚିନ୍ ଅଛି ଯେ କାହିଁକି ପେନ୍ ହେଲା ଏବଂ ମୁଁ କାହିଁକି ଏଥିରୁ ସଫରିଂ ହେଇକି ଅଛି, ମୋତେ ଗଡ଼ ଏ ପେନ୍ଫୁଲ୍ ସିଚୁଏସନ୍ କାହିଁକି ଦେଇଛନ୍ତି, ବୋଧେ କିଛି ଶିଖିବାର ଅଛି, ସେଥିପାଇଁ ଜାଣିବାର ଅଛି, ସେଥିପାଇଁ ପେନ୍ଫୁଲ୍ ସିଚୁଏସନ୍ ଦେଇଛନ୍ତି। ତ ଏଇଟା ଗୋଟେ ସ୍ପିରିଚୁଆଲ୍ ଫ୍ୟାକ୍ଟର ଯେଉଁଟାକି ପେନ୍ ଏ ସ୍ପିରିଚୁଆଲ୍ ଫ୍ୟାକ୍ଟର ଉପରେ ଆଫେକ୍ଟ ପକାଇଲା। ପେନ୍ ଯୋଗୁଁ ହିଁ ସ୍ପିରିଚୁଆଲ୍ ଫ୍ୟାକ୍ଟରରେ କିଛି ପରିବର୍ତ୍ତନ ଆସିଲା, ବ୍ୟକ୍ତିର ଇଣ୍ଡିଭିଜୁଆଲ୍ ଭିତରେ ପରିବର୍ତ୍ତନ ଆସିଲା, ତେଣୁ ସେ ଗଡ଼କୁ କିଛି ଦାୟୀ କଲା ଏବଂ ଗଡ଼ଠୁ କିଛି ଶିଖିବ ବୋଲି ଟ୍ରାଏ କଲା। Then the psychological factor, then under the psychological, that anxiety also increase the perception of pain. Okay, the critical ill patient or injured patient who perceive the lack of control over their environment, and the critical ill patient, injured patient who are hear the loud sound, and there is no ventilation pattern, excess crowding, and there is a uncomfortable environment, so that, and unknown about the hospitalizations, unknown about the procedures, that type of patient feel more anxiety, and that person's progress towards the chronic pain conditions. Then the coping style. The persons who receive the less pain, that type of persons adjust with the situation very perfectly than the persons who has feel the more pain. So less pain, the persons who has less pain, that persons has capability to adjust with the situations and makes reassurance towards yourself. The persons who has severe pain, that type persons are unable to cope with the situations, they have less cope with the situations. That is the coping style. Then come to the cultural factors, also culture beliefs that and values also affect to the these are affected by the pain. Okay. Every individuals, they learn from the society, learn from the culture, belief that how he or she will experience pain, how he or she will recover from the pain. Okay, so culture also affect pain to the individuals, and by which pain experience will come from the individuals, from the individual face. So cultural belief and value ମଧ୍ୟ ପେନ୍ ଉପରେ ଆଫେକ୍ଟ ପକାଇଥାଏ। ପେନ୍ ମଧ୍ୟ କଲଚର ବିଲିଭ୍ ଭ୍ୟାଲ୍ୟୁ ଉପରେ ଆଫେକ୍ଟ ପକାଇଥାଏ ଏବଂ ଇଣ୍ଡିଭିଜୁଆଲ କଲଚରରୁ ବା ସୋସାଇଟିରୁ ଇଣ୍ଡିଭିଜୁଆଲ ଶିଖିଥାଏ ଯେ ସେ କିଭଳି ଭାବରେ ପେନ୍କୁ କୋପ୍ କରିବ ଏବଂ ପେନ୍ର କେମିତି ଏକ୍ସପ୍ରେସନ୍ ଦେଖିବ, ସବୁ କଲଚରରୁ ହିଁ ଶିଖିଥାଏ। ଇଣ୍ଡିଭିଜୁଆଲରୁ ଇଣ୍ଡିଭିଜୁଆଲ ଏଗୁଡ଼ାକ ସବୁ ଜାଣିଥାନ୍ତି। ଜେନେରେସନ୍ ମଧ୍ୟ ଏଇ ଲର୍ଣ୍ଣିଂଟା ତାଙ୍କ ମାଇଣ୍ଡରେ ଆସିଥାଏ ଏବଂ କଲଚରରେ ମଧ୍ୟ ସେ କିଭଳି ଡେମନଷ୍ଟ୍ରେଟ୍ କରିଥାଏ ପେନ୍ ଲେଭେଲଟାକୁ ଏବଂ କିଭଳି ତାକୁ କେୟାର କରିଥାଏ। ତେଣୁ କଲଚର ପେନ୍ ଦ୍ୱାରା ମଧ୍ୟ କଲଚର ଫ୍ୟାକ୍ଟର ମଧ୍ୟ ଇନଫ୍ଲୁଏନ୍ସ ହେଲା ଏବଂ କଲଚର ଫ୍ୟାକ୍ଟର ଇଣ୍ଡିଭିଜୁଆଲ ଶିଖିଛି, ଜାଣିଛି ଯେ ପେନ୍ କେମିତି କଣ୍ଟ୍ରୋଲ କେମିତି ହେବ, ତେଣୁ ସେ ସେଇ ଟାଇପ୍ର ପେନ୍କୁ କଣ୍ଟ୍ରୋଲ ବା ମ୍ୟାନେଜମେଣ୍ଟରେ ପେନ୍କୁ କଣ୍ଟ୍ରୋଲ କଲା ଏବଂ ପେନ୍ ଲେଭେଲଟା ରିଡ୍ୟୁସ୍ ହେଲା। So when individuals experience pain, at that time for the coping of pain many signs and symptoms arises at that time। ଯେତେବେଳେ ବ୍ୟକ୍ତିକୁ ପେନ୍ ହେଉଛି ତ ପେନ୍ ସହିତ କୋପିଂ କରିବା ସମୟରେ ତ କେତେଗୁଡ଼ା ସାଇନ୍ ସିମ୍ପଟମ୍ ଦେଖା କରୁଛି। ଫାର୍ଷ୍ଟ ଇଜ୍ ଦ sympathetic response, patient has the increased blood pressures, people becomes dilated, there has the rigidity and tension in the muscle, glucose level will increase, and during the severe deep pain in the individual's parasympathetic system will be provided greater responses, like the person has the nausea and vomiting, patient becomes fainting, and patient goes towards unconscious conditions, blood pressure decrease, pulse rate also decrease. At the time of the pain, person's behavior also be changed. There are changes in the person's becomes a grimacing that will be appear from the facial expression, and person do the crying, person cannot take rest, cannot do the sleep. Okay, and he also refuse to anything to accept, and the painful area will be not protected, the patient feels more pain. Okay, in the affective the persons becomes restlessness, persons withdraw from the situations, and becomes worry, restlessness, and becomes very anxiety stage, remains in the anxiety stage, persons goes to the depression condition, person has the fear। ତାହେଲେ ବ୍ୟକ୍ତି କ'ଣ ହେବ, ଆଫ୍ରେଟ୍ ଷ୍ଟେଜ୍ରେ ସେ ଯେକୌଣସି କାମରୁ ଓହରି ଆସିବ, ୱିଡ୍ରାଲ୍ ହେଇ କରିଦେବ, ସେ ରିଫ୍ୟୁଜ୍ କୌଣସି କାମ କରିବା ପାଇଁ ତାକୁ ସେ ରିଫ୍ୟୁଜ୍ କରିବ, ମନା କରିଦେବ, ରେଷ୍ଟଲେସ୍ କଣ୍ଡିସନକୁ ଚାଲି ଯାଇଥାଏ ଏବଂ ଆଂଜାଇଟି ଷ୍ଟେଜ୍ରେ ରହିଥାଏ। ନେକ୍ସଟ କମ୍ସ ଟୁ ଦ ଆକ୍ୟୁଟ୍ ଭର୍ସେସ୍ କ୍ରୋନିକ୍ ପେନ୍। ଇନ୍ ଦ ଆକ୍ୟୁଟ୍ ପେନ୍ that is very rapid onset, it lasts to the 0 to 2 to 6 months. Okay, it is short durations, example inflammation and type of injury, that is example of the acute pain. And example is the sore throat, post-surgical pain is the acute pain. Chronic pain, it lasts to 6 months to day, weeks or year. Okay, it interferes the normal functioning. Example is the migraine headache is the example of the chronic pain. Then come to the pain assessment and management. Pain assessment is designed by the word PQRST. P for percepting elevating factor, Q for quality of pain, R for radiation, S for severity, T for timing. So during the assessment of pain, to know the observation, to know the causes of the pain, why pain occurs to the patient, So more vast details to knowing the vast details of the patient, so pain assessment required. Okay, the first is in the pain assessment करिया ପାଇଁ हेले व्यक्तिर डिटेल हिस्ट्री कलेक्शन करा जाय थाए एवं ताहाकू आमे गोटे पी क्यू आर एस टी वार्ड रे डिवाइड पी क्यू आर एस टी वार्ड रे डिजाइन करिछे तो पी फॉर परसेप्टेटिंग इन द परसेप्टिंग स्टेज we will know about that what causes the pain, what type of medications and treatment taken during the past period. This data will be collected. Then come to the quality of pain. In the quality of pain, the doctors will ask to the patient that to describe details about the pain, and also ask to the patient gives explanation regarding pain by using word like the sharp, dull, stabbing, burning, etc. तो क्वालिटी पेन रे कौन हुए डॉक्टर कौन करती नर्स डॉक्टर कौन करती पेशेंट को कहती डिटेल पेन विषय एक्सप्लेन करने एवं से किसी वर्ड यूज करके एक्सप्लेन करूँ जो पेन को जहाँ कहती से कहवा कहती एग्जांपल शार्प पेन हो कि डलनेस हो कि स्टाबिंग हो बर्निंग हो देन कम टू द रेडिएशन. In the radiation stage, doctor asks to the client to express their painful conditions by according to the location and radiation of pain from the original place. तो कौ लोकेशन रे पेन स्टार्ट होइछि एवं से लोकेशन रु आउ को जगह को पेन ट्रांसफर होइछि बा स्प्रेडेड होइछि तो ताकू आमे ताकू मध्य पेशेंट एक्सप्लेन द्वारा जानी होता है. ओके बा पेशेंट को देखिए जानी होता है. नेक्स्ट इज द सेवेरिटी. इन द सेवेरिटी कंडीशन द डॉक्टर नो अबाउट द पेन लेवल बाय यूजिंग द न्यूमेरिक विजुअल स्केल एंड डेस्क्रिप्टिव स्केल. तो डेस्क्रिप्टिव न्यूमेरिक विजुअल स्केल माध्यम पेन केते बना रही ताकू जानी होते ताकू आम पेन सेवेरिटी कंडीशन सेवेरिटी कही था. देन इन द टाइमिंग we know that you will ensure that the patient who feel pain that is constant or intermittent. जो पेन होची ताहा कांस्टेंट भले होची कि रही रही होची ए विषय जानवा को मिलता है बा ताकू आम जानवा उचित पेन असेसमेंट रे. तो फास्ट है पेन असेसमेंट आगे फास्ट पेन केमिति होची कौन पाई होची जानवा उचित. तो पेन असेसमेंट रे व्यक्तिर फास्ट जानवा उचित इन परसेप्टिंग स्टेज रे द परसेप्टेटिंग बा एलिवेटिंग फैक्टर्स अनुसार आम जान कौ टाइप पेन होची किए पेन क्रिएट करुच्ची कौ टाइप मेडिसिन ट्रिटमेंट प्रिवियस खाई एवं सेकेंड रे देखा क्वालिटी ऑफ पेन. तो पेशेंट को पचार कहवा जे डिटेल से पेन डिस्क्राइब करूँ जथा वर्ड यूज करके जथा शार्प, डल, स्टबिंग, बर्निंग. देन कम टू द रेडिएशन. इन द रेडिएशन अर्थ है जे पेशेंट कौ जगह पेन हो लोकेशन पेन कौटी रोचे और से पेनटा कुआड़े कुआड़े केउ आड़ को रेडिएट होची ताहा जानिबा उचित. सिवियरिटी कंडीशन पेशेंट कौ टाइप पेन लेवल अच्छी ताहा हमें डेस्क्रिप्टिव न्यूमेरिकल और विजुअल स्केल द्वारा जानी होता है. टाइमिंग रे जानिबा जे से पेनटा कांस्टेंट हो कि इंटरमिटेंट होची एगुड़ा फास्ट जानिबा उचित. पेशेंटर पेन कंडीशन कहीं होची आ कोठी होची आ केउ आड़े होची एवं कौ टाइप पेन होची आरि माध्यम आम पेन आसेसमेंट फास्ट करवा. तो पेन विषय डिटेल डिस्क्रिप्शन जानिबा जानला परे से अनुसार प्रॉपर ट्रीटमेंट देले पेन लेवल डिक्रीज होता है. पेन आसेसमेंट मध्य कौन कहवा पेशेंटर ऑब्जेक्टिव साइन गुड़ाक देखा. तो पेशेंट ऑलरेडी कही सारी तो तार साइन सब कौन रही आम देखिकी जाना. तो देन द एट द टाइम ऑब्जेक्टिव साइंस लाइक द फेशियल एक्सप्रेशंस ऑब्जेक्टिव साइन गुड़ाक सब्जेक्टिव पेशेंट कहला जे तार कौ टाइप पेन हो ऑब्जेक्टिव कंडीशन साइन रे नर्स कौन देखिले डॉक्टर कौन देखिले जे कौ टाइप तार सब साइन सिम्पटम रोच. इन द फेशियल एक्सप्रेशन वी सी दैट पेशेंट हैज द फेशियल ग्रीमासिंग in the facial grimacing we also see that there is facial changes in the facial expressions, and there are the discussed or patient feel severity of pain. And also seen that frowning condition in the facial expression. In the frowning condition, facial expression in the facial expression persons the individual's eyebrows becomes brought together and forward becomes wrinkled. So when person feel pain, we determine the levels of pain, or we determine the how the pain will be created by determining of the objective sign of the pain. The objective signs first is the facial expression. In the facial expression, first is the facial grimacing. In the facial grimacing, we know about that what of the changes occurs in the facial expressions. And in the frowning stage, in the frowning condition of the patient, we determine the how eyebrows are comes brought together and forward becomes wrinkled. And the vocalization conditions during the severity pain, a person feels severity pain, how the person becomes crying mourning stage. And the persons either will be moved anywhere or not, or sitting in one area or one place or in a chair, so that body movement will be observed at the time of the feeling of pain. See that it is the picture of the grimacing, and it is the picture of frowning. In the frowning stage, in the frowning condition of the patient, in the facial expressions where he feels pain, and we see the that pain by observing the facial expressions. In the facial expression, that see that eyebrow brought together, forehead becomes wrinkled. And in the grimacing stage, see that their facial expression changed, how the persons feels pains, it will be observable. Then come to the pain assessment tool. We will be determine the pain level by the using the verbal rating scale, numeric rating scale, wrong Becker's face pain scale. So in the verbal rating scales, see that first is the no pain. When patient is happy, that means the patient has no pain. In the mild pain, patient has pain level very less. In the moderate pain, pain becomes progress. And the severe pain, that is means it chronic pain will feel by the individuals. And in the very severe pain, patient goes to a fatal stage, and patients lost something due to the possibility of a pain. So it is the verbal rating scale. So how much individual said, and according to it, pain levels will be measurable. Patient, if patient is say that he is happy, or she has no anger, or she is very feel the very enjoyable conditions, enjoyable environment, and patient has he has very in the anxious stage, that means patient has no pain. And patient has feeling the pain due to the injury, certain injuries, that is a mild pain. And patient has feels greater than the mild pain, that is a moderate pain. Patient has I am feel very my abdomen becomes cramping stage. So cramping becomes very less, so that person that pain is the severe pain, known as severe pain. When when individuals are rolled above the earth due to the cramping of the abdomen, so that it is known as the very severe pain. Very severe pain पेट cramping हेल्ले कौन हम ना व्यक्ति बेड उपर गड़ी थाए कि तले गड़ी जाए, एपट सेपट गड़ी जाए, तो सेटा भेरी सिवियर पेन फिल है बोली आम जानी था. तो एथिरे किछि लॉस होबार संभावना थाए, तो रोस्ट पॉसिबल पेन. In the numeric rating scales, pain interest level of pain also be indicated by the digits, that is 0 to 10 numerical pain scale. So there in the scale there is just 0 to 10 digits. Okay, 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So in the 0 levels, in the 0, if the patient no pain, then it will be labeled in under the 0 and write that no pain. Okay. And when person has some pain, and that is the known as moderate pain, and it is written the pain level is the 5. when persons rust something due to the possibility of pain, then it is written that pain level is the 10. তাহলে moderate pain ଥିଲେ patient 5 রে কাউন্ট করা যায়, কারণ ନ୍ୟୁମେରିକାଲ ପେନ୍ ଇଣ୍ଟେନ୍ସିଟିରେ 0 to 10 ଯାକେ ରହିଛି। ତ ପର୍ସନର ପେନ୍ ଅନୁସାରେ ସେଟାକୁ କାଉଣ୍ଟ କରାଯାଏ। ଯେତେବେଳେ ତାକୁ ପେସେଣ୍ଟର ପେନ୍ ନାହିଁ ତାହେଲେ ସ୍କେଲରେ ଦେଖ 0 ଲେଖା ହେଇଛି ନୋ ପେନ୍, ତାହେଲେ ପେସେଣ୍ଟର ପେନ୍ ନାହିଁ ଏବଂ ଏହା 0 ଲେବୁଲ୍ ଅଛି। ଯେତେବେଳେ ଦେଖିବା ତା ପେସେଣ୍ଟ ମଡରେଟ୍ ପେନ୍ ରହିଛି, ଟିକେ ଅଧିକା ପେନ୍ ରହୁଛି, ତ ସେଇଟା ଲେବୁଲ୍ 5 ବୋଲି ଲେଖାଯାଏ। କାରଣ ଅଲରେଡ଼ି ସ୍କେଲରେ ଡାଇଗ୍ରାମରେ ଦେଇସାରିଛି ଯେ ଯଦି ପେନ୍ ନାହିଁ ତାକୁ 0ରେ ଲେଖାହେବ, ଯଦି ପେନ୍ ଟିକେ ଅଧିକା ଅଛି ତାକୁ ମଡରେଟ୍ ପେନ୍ ଲେଖାଯିବ, ଯଦି କିଛି ସେ ଲଷ୍ଟ କରିଛି ତାହେଲେ ରୋଷ୍ଟ କଣ୍ଡିସନକୁ ଯାଉଛି ତାହେଲେ ତାକୁ 10 ଲେଖାଯିବ। ତାହେଲେ ସେଇ ଅନୁସାରେ ପେନ୍ ଲେବୁଲ୍ଟା କରାଯାଇଛି, ସ୍କେଲରେ ଅଲରେଡ଼ି ଲେଖା ଅଛି। ତ ସେଇ ଅନୁସାରେ ବ୍ୟକ୍ତିକୁ ପଚାରିକି ତାର ପେନ୍ କେଉଁ ଲେବୁଲ୍ ଅଛି ସେଇ ଅନୁସାରେ ଲେଖାଯାଏ। ଆଇଦର 0 ଲେଖାଯାଏ, 1 ଲେଖାଯାଏ, 2 ଲେଖାଯାଏ, 3, 4, 5, 6, 7, 9, 10 ପର୍ଯ୍ୟନ୍ତ ଲେଖାଯାଇଥାଏ। The wrong Becker's facial pain scale, facial expression ମଧ୍ୟ ପେନ୍ ସ୍କେଲ୍, ଫେସିଆଲ୍ ଏକ୍ସପ୍ରେସନ୍ ଦ୍ୱାରା ମଧ୍ୟ ପେନ୍ ସ୍କେଲ୍ ହୋଇଛି ଏବଂ ସେଇ ପେନ୍ ସ୍କେଲ୍ ମାଧ୍ୟମରେ ଫେସିଆଲ୍ ଏକ୍ସପ୍ରେସନ୍ ଦେଖିକି ତାହାକୁ ମେଜରେବୁଲ୍ କରାଯାଏ ଏବଂ ତାର ସ୍କୋର୍ ମଧ୍ୟ ଲେଖାଯାଏ। The patient is happy, that is a person has no hurt, and person feels some bad or becomes hot, that is score level 1, and that hot will be felt by the individual. If the hot becomes hot or pain becomes more, then score is 2. If the hot even more or becomes much more, the person feels more anxious, that is score level 3. When the person's eye becomes very red and who will feel the severe pain, that is the level of the 4. When persons becomes very persons in the roast condition becomes crying, that is level of the 5. According to it, pain, the wrong Becker's facial pain scale, that will be measured and that is score will be written. So according to the seeing the scale, the nurse observe the patient's facial expression, according to it the facial expression and seeing the facial scale, then write the records. So pain level remains in which score. ଯଦି ପେସେଣ୍ଟ ତାକୁ କିଛି ପେନ୍ ହୋଇନାହିଁ ତାହେଲେ ସେ ଲେଖିବ ଯେ ରେକର୍ଡ଼ରେ ନୋ ହଟ୍ ଆଣ୍ଡ ସ୍କୋର୍ ଇଜ୍ 0। ସ୍କେଲ୍କୁ ଦେଖିକି ସେ ଏପଟେ ସ୍କେଲ୍କୁ ଦେଖିବ, ସେପଟେ ପେସେଣ୍ଟର ଫେସିଆଲ୍ ଦେଖିକି ମ୍ୟାଚ୍ କରିକି କ'ଣ ହେବ ରେକର୍ଡ଼ରେ ଲେଖାଯାଏ ତ ପେନ୍ ତା'ର କେତେ ରହିଛି। ଓକେ, ତ ଇଣ୍ଟେନ୍ସିଟି ଅନୁସାରେ ମୁଁ କହିଥିଲି ମିଲ୍ଡ ପେନ୍, ମଡରେଟ୍ ପେନ୍, ସିଭିୟର୍ ପେନ୍। ଯଦି ପେସେଣ୍ଟ ମାଇଲ୍ଡ ପେନ୍ ଅଛି ତାହେଲେ ସେଟା ସ୍କୋର୍ ହେଉଛି 1 to 3। ସିଭିୟର୍ ପେନ୍ ମଡରେଟ୍ ପେନ୍ରେ 4 to 6 ଲେଖାଯାଏ, ସିଭିୟର୍ ପେନ୍ରେ 7 to 10 ଲେଖାଯାଇଥାଏ। ତ ପେନ୍ ମେଜରମେଣ୍ଟ ସ୍କେଲ୍ ରହିଛି ଯେଉଁଟାକି କହିଛି ଯେ ନୋ ହଟ୍ରେ 0 ବୋଲି ଥାଏ, ହଟ୍ସ ଟିକେ ହଟ୍ ହେଲେ ତାକୁ ସ୍କୋର୍ ଲେବୁଲ୍ 2ରେ ଲେଖାଯାଏ, ହଟ୍ ଅଧିକା ହେଲେ ତାକୁ 4, ହଟ୍ ଆହୁରି ଅଧିକା ହଟ୍ ହେଲେ ତାକୁ 6, ଆଉ ଟିକେ ହଟ୍ ହେଲେ 8, ଆଉ ପୁରା ହଟ୍ ହେଲେ ତାକୁ 10 ବୋଲି କୁହାଯାଇଥାଏ। 10 ଲେବୁଲ୍ରେ ପେସେଣ୍ଟ କ୍ରାଇଂ କଣ୍ଡିସନ୍କୁ ଆସିଥାଏ ଏବଂ 0 କଣ୍ଡିସନ୍ରେ ସେ ହାପିନେସ୍ ଥାଏ, ଆଉ ଟିକେ ହଟ୍ ଥିଲେ ମଧ୍ୟ ସେ ଖୁସି ଥାଏ, ଟିକେ ହଟ୍ ଥାଏ। ତ ତା ଛୋଟ ଇଞ୍ଜୁରି ହେଲା ତ ତାକୁ ସ୍ମାଇଲ୍ ଟିକେ ଆଞ୍ଚୁଡ଼ି ହେଇଗଲା ତ ସେଇଟା ହର୍ଟ୍ସ ଲିଟିଲ୍ କୁହାଯାଏ। ଯଦି କଟ୍ ହେଇଗଲା ତାହେଲେ ହର୍ଟ୍ସ ଲିଟିଲ୍ ମୋର୍ ହେଇଯାଏ। ଯଦି ବଡ଼ି ସ୍କିନ୍ କଟ୍ ହେଇଗଲା ତାହେଲେ କ'ଣ ସ୍କିନ୍ର କୌଣସି କଣ୍ଡିସନ୍ରେ କଟ୍ ହେଇକି ବ୍ଲିଡ଼ିଂ ହେଲା ତାକୁ ହର୍ଟ୍ସ ଲିଟିଲ୍ ମୋର୍ କୁହାଯାଏ। ଯଦି ସେଇଟା ଇନଫେକ୍ସନ୍ ହେଇକି ସେଠି ପସ୍ ଫର୍ମେସନ୍ ହେଲା, ରେଡନେସ୍ ହେଲା ଏବଂ ଅତ୍ୟଧିକ ପେନ୍ କ୍ରିଏଟ୍ ହେଲା ତାକୁ ହଟ୍ ଇଭେନ୍ ମୋର୍ କୁହାଯିବ। ତାପରେ ସେଠି ପସ୍ ଫର୍ମେସନ୍ ହେଇକି ଯଦି ସେଇ ଜାଗାକୁ କ'ଣ ହେଲା ଫ୍ୟୁଚର୍ରେ ସର୍ଜିକାଲ୍ ପ୍ରୋସିଜର୍ କରାଗଲା, ରିମୁଭ୍ କରାଗଲା, ତାପରେ ପେନ୍ ଅତ୍ୟଧିକ କ୍ରିଏଟ୍ ହେଲା ପସ୍ ରହିକି କିମ୍ବା ତାକୁ ସର୍ଜରୀ ପ୍ରୋସିଜର୍ ପରେ ମଧ୍ୟ ପେନ୍ ଅତ୍ୟଧିକ ହେଲା ତାକୁ ହର୍ଟ୍ସ ହୋଲ୍ ହଟ୍ କୁହାଯିବ। ଯେତେବେଳେ ପେନ୍ ଆଉ ଟଏଲେଟ୍ କରାଯିବନି, ପେନ୍ ଅତ୍ୟଧିକ ହେଉଛି ତାକୁ ସେତେବେଳେ ବ୍ୟକ୍ତି କ୍ରାଇଂ କଣ୍ଡିସନ୍ ଆସୁଛି, ବ୍ୟକ୍ତି କ୍ରାଇଂ ଷ୍ଟେଜ୍ ରହୁଛି, ତାକୁ ହଟ୍ ରୋଷ୍ଟ କୁହାଯାଏ। ଓକେ, ତ 0 to 10 ଯାକେ ମଧ୍ୟ ରହିଛି। ତାହେଲେ 0 2 4 6 8 10ରେ ମଧ୍ୟ କାଉଣ୍ଟ କରାଯାଏ କିମ୍ବା 0 to ପୁରା ଟୋଟାଲ୍ 10 ଯାକେ ଡିଜିଟ୍ ଲେଖିକି ସେଥିରେ ମଧ୍ୟ କାଉଣ୍ଟ କରାଯାଏ। ନୋ ପେନ୍, ମାଇଲ୍ଡ ପେନ୍ ଫ୍ରମ୍ 2 to 3, moderate is the 4 to 6, that is level in that moderate 4 to 6, and in severe condition 7 to 8, and roast pain we imagine that the level of the 7 to 10. So how will manage the pain? So for the managing pain there is two things will be done, and that is first the pharmacological intervention will be carried on and non-pharmacological intervention will be progress. Okay, for to managing the pain. So in the pharmacology intervention we take medication like the non-opioids opiates and the adjuvants. Okay, this is the pharmacology intervention to taken the medications to relieve the pain. So non-opioid medications will be given to the patient with the mixed with the opioids medications to relieve the mild to moderate pain. Okay, तो mild to moderate pain को relieve करने पाई कौन करा जाए ना नॉन ओपियोइड मेडिकेशन रा ओपियोइड मेडिसिन तो मिक्स कर दिया जाता है. एग्जांपल इज द नॉन स्टेरॉइड एंटी इन्फ्लेमेटरी ड्रग्स, दैट इज एग्जांपल ऑफ द पैरासिटामोल, एस्पिरिन एक्सेट्रा. तो पैरासिटामोल एस्पिरिन नॉन ओपियोइड मेडिकेशन गोटे एग्जांपल याको पेन रिलीफ पाई दिया जाता है. ओपियोइड मेडिकेशन मध्य मॉडरेट टू सीवियर पेन दिया जाता है. मॉर्फिन, कोडेन एगुड़ा सब ओपियोइड टाइप मेडिकेशंस या मध्य पेन रिलीफ पाई दिया जाता है. adjuvants मध्य दिया जाए. इट इज ए एनाल्जेसिक, इट इज आल्सो हेल्पफुल फॉर द टू रिड्यूस द to relieve the pain, to reduce the stress or anxiety. Stress anxiety को relieve करें जाए, पेन relieve करें मध्य दिया जाता है. Example is the tricyclic antidepressants, antiepileptics, corticosteroids. These are type of drugs which is the example of adjuvants which are given to the patient to relieve the pain, to reduce the stress or anxiety. Then come to the in the pharmacology intervention, patient controlled analgesia. A patient controlled analgesia is a drug delivery system. Okay, and that is known as the patient controlled analgesia. Patient controlled analgesia होची गोटे drug delivery system, and it is a safe method of administration of medication to relieve the pain. Okay, so patient here self by oneself he administered the opioid medications to avoid the minimal risk of the overdose. So patients oneself administer the opioid type of medications like the morphine and fentanyl by herself or himself to relieve the pain. Here in the patient control analgesia, infusion pumps are there which are very portable, and it is computerized and contains a number of chambers. In the chambers there has the series or bag that delivers a small amount of opioids medications. When the patients according to the demand doses that push the button, then the opioid medications are released and released to the diagnosed area, and the patients feels more comfort and pain will be relieved. See that patient control analgesia machine is there. So patient control analgesia होची गोटे ड्रग डेलीवरी सिस्टम, जो सिस्टम रे कि पेशेंट निजे निजे कौन करिवो सेल्फ एडमिनिस्ट्रेटेड मेडिकेशन करि परिबो. सेल्फ एडमिनिस्ट्रेटेड ओपियोइड मेडिकेशन को करि थाए. मॉर्फिन, कोडाइन मेडिसिन गुडा को सेल्फ निजे निजे से कौन करे बटन प्रेस करिकी ओपियोइड मेडिकेशन को रिलीज होई थाए, एवं से मेडिकेशन को जो एरिया रे इंजुरी होती से एरिया उपर देले से एरियाटा धीरे धीरे भल हो जाए, एवं जी डोज दरकार से अनुसार बटन पुश करके स्किन उपर नहीं थाए. यही पेशेंट कंट्रोल एनाल्जेसिया रे कौन रही ना इट इज पोर्टेबल, यह गोटे पोर्टेबल अच्छे गोटे इनफ्यूजन पंप रही, इनफ्यूजन पंप पोर्टेबल और कंप्यूटराइज्ड अटे. ये गुड़े चैम्बर अच्छा से सिरिंज बैग रही जोटा कि पेशेंट कौन करे जो से पुश करे बटन को से ऑटोमेटिकली मेडिकल ओपन मेडिसिन गुड़ाक डेलीवरी हो जाए, और पेशेंटर पेन रिलीफटा पेशेंट रिड्यूस देयर पेन. Then topical analgesia also applied over the patient skin to relieve the pain. It is applicable available as the ointment or transdermal patches. ये ointment आकार मिली थाए. टॉपिकल एनाल्जेसिया मध्यम पेन रिलीव करे हेल्प करे एवं ointment आकार मिली थाए एवं पेशेंट स्किन ऊपर एटा अप्लाई करा जाय थाए. Here when the transdermal patches or topical analgesia, transdermal patches रे medication मध्य थाए analgesia medicine or ointment ointment. Okay, so transdermal patches रे किछे analgesia medication थाए से transdermal patches को कोन करे जोडी जगह इंजुरी होची से स्किन रो से जगह रे कोन अप्लाई करले तापर से स्टिकिंग हो रही थाए एवं मेडिकेशन डेलीवर मध्य करि थाए एवं पेन रिलीव होई थाए. So topical analgesia is applied over the skin and it is applicable it is available in the form of ointment or it is the transdermal patches. When the transdermal patches or ointment is applied over the injured area, the medications are delivered from the transdermal patches and mix in that area, and patients will feel comfort and pain will be relieved. See that transdermal patches is how it is applied over the injured area, and the medications in the transdermal patches will be delivered to the injured area, and patient feels comfort and relieve the pain. The local anesthesia is the that type of anesthesia medications also be applied to the patient who feel the pain, that induces the loss of sensation to any body part. So when the local anesthesia is given to the patient pain area, that reduces the loss of sensation, and so that patients feel less pain. So it is applicable for during the surgical procedure or removal of the skin lesion, or patient has dental pain. At that time local anesthesia is given, so that area becomes the loss of sensation and patient feel less pain. That local anesthesia कोड़ी जाए ना देखो सर्जिकल प्रोसीजर कराउछि कि स्किन लीजन को रिमूव कराउछि कि डेंटल पेन होउछि तो टीथ रिमूव करला समय तो लोकल anesthesia दिया जाय थाए. ओके, इधर ड्रग गुड़ा कौन टेम्पोरारी लॉस ऑफ सेंसेशन क्रिएट करते. ओके, सी दैट लोकल एनेस्थेसिया इज गिवन. नेक्स्ट कम टू द रीजनल एनेस्थेसिया. ऑल्सो इट इज इंजेक्शन इज गिवन टू द, इट इज द इंजेक्शन ऑफ द लोकल एनेस्थेसिया. लोकल एनेस्थेसिया गोटे इंजेक्शन अटे. इट ब्लॉक द ग्रुप ऑफ सेंसरी फाइबर्स. सेंसरी फाइबर को कौन करे ब्लॉक करिबारे ब्लॉक करि थाए. ओके, सेतिमे सेंसेशन लॉस हो जाए. Example, this type of regional anesthesia is given in the epidural anesthesia and spinal anesthesia. So regional anesthesia example है कौन ना epidural anesthesia और spinal anesthesia. Epidural anesthesia and epidural space रे दिया जाए, spinal anesthesia in the subdural space रे दिया जाता है, जोटा कि पेशेंट को हम पेशेंट रे सेंसेशन को लॉस करा जाए एवं पेशेंट लेस पेन फील करे एवं पेशेंट कंफर्टेबल मध्य कंडीशन रे रही है. तापर जेकोसी प्रोसीजर करागले भी किसी जना पड़ न थाए. देन कम टू द नॉन फार्माकोलॉजिकल थेरापी. In the non-pharmacological therapy, the methods are heat and cold application, medication, distraction, imagery, tense application, music therapy, massage, yoga, acupuncture, herbal therapy like the garlic, echinacea, ginseng. Okay, so first see that heat and cold application. So the persons who are feel pain, so above the pain area, nurse should apply warm bath, heating pads, ice bag, ice massage, hot and cold compress, cold siege bath for relieving the pain. ताले hot and cold application रे कौन होला जति जो पेशेंट जो जगह पेन फील कर से जगह पर वार्म बाथ पेशेंट को कहा जाए तो पेशेंट से एरिया पर हीटिंग पैड्स अप्लाई करा जाए, आइस बैग्स अप्लाई करा जाए, आइस मैसेज करा जाए, हॉट एंड कोल्ड कंप्रेस मध्य दिया जाता है एवं पेशेंट को मतलब वार्म बाथ दिया जाए, सीज बाथ मध्य दिया जाता है. देन कम टू द मेडिसिन. मेडिसिन्स इज ए प्रैक्टिस where individual uses various type of technique. Here individuals uses technique like the mindfulness. In the mindfulness situations, patient focusing the mind on a particular object, focusing their mind on particular object, thought or activities. तो meditation stage रे कौन हुए ना meditation is a practice where an individual uses a technique such as mindfulness or focusing the mind on a particular object, thought or activities. ताल मेडिसिन स्टेज रे कौन हुए ना मेडिसिन स्टेज गोटे पर्टिकुलर गोटे प्राक्टिस अटे. एथरे गुडे टेक्निक यूज करा जाय थाए. से टेक्निक मध्यम गोटे है माइंडफुलनेस. माइंडफुलनेस टेक्निक द्वारा कौन हुए व्यक्ति मेडिटेशन रे कौन करे ना तार माइंड को गोटे पर्टिकुलर ऑब्जेक्ट, थॉट बा एक्टिविटीज रे रखी थाए. रखले कौन हुए ना इट हेल्प द इंडिविजुअल टू इंक्रीज अवेयरनेस अबाउट देयर सराउंडिंग्स, create positive mood, reduce stress, control anxiety and promote the emotional health, and it is applicable for the relieve the pain if having within the body. Then come to the distraction. In the distraction, that is, and the distraction is the in the distraction stage. What is the distraction? Distraction is the having one's thought or attention drawn away, unable to concentrate or give attention to something. व्यक्ति केवल कौन सी जिनस अटेंशन दे पारिबो नहीं है तो ताको आम डिस्ट्राक्शन कही था. सो डिस्ट्राक्शन हियर पेशेंट शिफ्टिंग और मूविंग देयर अटेंशन आउट फ्रॉम पेन इफ पेन विल बी परसिस्ट. और एक्जिस्ट जदि व्यक्ति को पेन एक्जिस्ट अच्छी ताहले व्यक्ति कौन करा जाए ना पेन ठारू तार अटेंशन को आउ कौन सी सिचुएसन प्रति कनसेंट देवाक कह जाए ओके तो व्यक्ति पेन ठारू दूरे रही से अन्य कौन सिचुएसन सहित एडजस्ट करें एवं अन्य कौन सिचुएसन रे से ता माइंड खर्च करें तो इन द डिस्ट्रेशन स्टेज when the person feel pain when person feel pain at that time person should be the nurse or any other person should advise to the patient to shift their attention towards anything that is away from the pain ताले ताकू जो पेन व्यक्ति फिल करुच्ची तो ताकू कह जे तू पेन ठारू तार माइंड को अन्य कौन सी आड़े लगेवाई तो माइंड को अन्य कौन सी आड़े स्पेंड करने अन्य कौन सी आड़े ताकू से सिचुएसन सहित भावियापाई कह जाए ओके सो shifting or moving attention out from pain that will be done in the distraction stage of the person when person feel the pain what is the here use your brain to focus your attention onto something okay and example you when you feel pain you put your pain in the background and you continue focus your mind to using the breathing technique and many other activities ओके जो तुम पेन हो तुम पेन टाक तुम बैकग्राउंड रे बाहर रख अनकॉन्शियस माइंड रखीदेव पेन होली एवं तुम कौन कर तुम आक्टिविटी तुम कौन ब्रीथिंग टेक्निक आक्टिविटीज रे निजक एनगेज करब आउ अदर आक्टिविटी एनगेज कर पेन तुमको जना पड़ ना ओके अदर एग्जाम्पल्स आर डीप ब्रीथिंग टू रिलैक्स योर बॉडी विथ ईच ब्रीथ इन एंड आउटलेट योर बॉडी रिलैक्स काउंट to 4 on the way in and 4 on the way out. Another example is deep breathing. Breathe to relax your body with each breath in and out let your body relax. Count to 4 on the way in and 4 on the way out. So if you use the breathing technique that is helpful for the relax your body with each breath during the inhalation and exhalation you feel the relax okay so that for that reasons to engage your activity towards the breathing technique so you count such like that 1 2 3 4 during the breathing in and count like that 4 3 2 1 during the exhalation so जो प्रश्वास नौ तो 1 2 3 4 कहीकि नवा जो छाड़ुंट तो 4 3 2 1 कहीकि छाड़ा तो जो पेन बॉडी क्रिएट हो यही टाइप टेक्निक यूज करवा जो पेन क्रिएट हो समय 1 2 3 4 कहीकि कौन करवा प्रश्वास नवा एवं 4 3 2 1 कहीकि निश्वास छाड़ा ओके तो यही सब डीप ब्रीथिंग टेक्निक रे माइंड को कंसंट्रेशन करवा देन कम टू द इमेजरी another example of distraction is that alphabet changes pick a letter and by that letter alphabet use a word use a topic of food okay so other example is the alphabet challenges so pick a letter of the alphabet and then arrange a topic रिगार्डिंग द फूड्स तो गोटे लेटर गोटे आल्फाबेट आरेंज रे कौन करा जिवो आल्फाबेट आरेंज रही तो गोटे लेटर को पिकअप करिवो एवं से लेटर नहीं गोटे खाद्य उपरे गोटे टॉपिक दबो एग्जांपल इफ यू टेक वर्ड लाइक द एल देन यू विल अरेंज द फूड लाइक लॉलीपॉप और लेमन तो गोटे किसी वार्ड धर मन करे एल आइल हरी आल्फाबेट आरेंज रे वार्ड गुडा आल्फाबेट आरेंज लेटर गुडा रही आल्फाबेट आरेंज रे लेटर गुडा रही से गोटे लेटर आइल मन कर से लेटर होची एल ताले से लेटर एल द्वारा तुम कौन तैयारी कल गोटे फूड वार्ड तैयारी कल लॉलीपॉप और लेमन सो इट इज वन टाइप ऑफ एग्जांपल ऑफ द डिस्ट्रैक्शन तो माइंड टाको यही टाइप जदि पेन होची ताले तमे अन्य दिग आड़ को माइंड टाको रखिबो ताले पेन रिड्यूस हो पारिबो देन कम टू द इमेजरी So here in the imaginary situation place your mind in a state of deep relaxation okay तो imaginary state रे कौन होची ना what is imagery is makes by use of a particular words that create visual representation of idea in your mind. Okay, तो किसी वर्ड को गोटे पर्टिकुलर वर्ड को लेकिन तुम कौन कर विजुअल रिप्रेजेंटेशन क्रिएट कर से विजुअल रिप्रेजेंटेशन किसी माइंड खर्च करके करा जाय थाए. ओके, एग्जांपल व्हेन यू वॉक ऑन द वे यू स्मेल something that comes from the grasses level on either side of the path, and what you could taste and what you could touch. So everything, the five senses undergo the imagery stage. Okay, imagery stage contain the five senses like the touch, taste, smell, okay, sight, etc. So when you go to the on the pathway, so whatever the smell comes, that will be, you will be know, and what you could taste, what you could touch. So everything undergo the imaginary period. So you had imagine in the imaginary situation what happen. Example, when in the imaginary situations you do like that, you had imagine what you could smell like the fresh grass on the either side of the path, what you could taste and what you could touch. जितने तुम बाटर जाऊँ तो से ग्रास लेवल कौ टाइप स्मेल आसला, तुम कौन कौ टाइप टेस्ट कौन खाई तार कौन टेस्ट थिला, तुम कौटी कौन तुमको किए टच करा तुम क्या सहित आटाच होकर रही. तो यही सब गुड़ा फाइव सेंसेस गुड़ाक सब आक्टिवेशन होकर रही है, ताको आम इमेजरी कही था. So in the imaginary situation, how imaginary situations relieve the pain? In the guided imagery places our mind into a state of deep relaxation. तो जितने तुमको पेन होची तो सेतले तुमर माइंड को करिवो ना डीप रिलैक्सेशन आड़ को रखिवो. That helps to reduce the presence of stress hormones, decrease muscle tension and shifted your attention away from the pain to create positive image. ताले एथरे कौन है ना जदि guided imagery रे कौन है ना माइंड को डीप रिलैक्सेशन आड़ को रखा ताहले से आमर स्ट्रेस हार्मोन को कमेदेव एवं मसल टेंशन कमे दिए एवं अटेंशन को डाइवर्ट पेन रु डाइवर्ट करके अन्य आड़ को रखे एवं पॉजिटिव इमेज आसी थाए. देन कम टू द टेंस एप्लीकेशन. So tense application is known as the transcutaneous electrical nerve stimulation. So it is a method of applying. So tense transcutaneous electrical nerve stimulus. It is a method of applying low voltage electrical stimulation directly over the identifying the pain area. एथरे कौन हुए ना लो वोल्टेज इलेक्ट्रिकल स्टिमुलेशन कौन करा जाए, टेंस रे कौन करा जाए ना लो वोल्टेज इलेक्ट्रिकल इंपल्स जो पेन होची से जगह रे दिया जाय थाए. In the tense, it sends electrical impulses through the skin to start your body's own pain killer. तो टेंस रे कौन हुए ना स्किन रे इलेक्ट्रिकल पल्सेस क्रिएट हुए एवं बॉडी रे पेन किलर क्रिएट हुए, बॉडी रे पेन रिलीव हो जाए. ओके, here electrical pulses can relaxes here electrical pulses which were created by the tense application of tense that release endorphins. Endorphins is the hormone that will be helpful to reduce the pain. ताले टेंस टेंस रे कौन हम इलेक्ट्रोड द्वारा कौन हुए ना लो वोल्टेज रे स्टिमुलेशन बॉडी रो पेन ऊपर दिया जाए थाए. इलेक्ट्रिकल यह इलेक्ट्रिक सहित अटैच होता है, तेणु से जो लो वोल्टेज आसे से कौन हुए ना लो वोल्टेज से पेन एरिया को जाए, से जो स्टिमुलसटा जाए से स्टिमुलस रे कौन हुए स्टिमुलस द्वारा बॉडी रे कौन हुए ना ओन पेन किलर तैयारी हुए, कहीं एंडोर्फिन बोली हार्मोन मत क्रिएट हुए एवं एंडोर्फिन हार्मोन कौन करे ना पेन रिलीव करिबारे हेल्प करि थाए. So tense can reduce the pain. It is used to drug activity such as walking exercise. तो walking exercise कला समय ड्रग यूज कर होता है. Then come to the music therapy. So music therapy also reduce the pain, chronic pain by providing the sensory stimulation. It also reduce the amount of pain, promote relaxation to the person, do the rhythmic breathing and provide the rest and provide the muscle relaxations. Here also do the music therapy, so endorphins hormones are released and also helpful for the reduce the pain and changes the catecholamines levels also. So example of the music therapy, the playing musical instrument, listening to the music, writing and singing song, using musical device and technology. The example of the music therapy. Then come to the message. Massage. So therapeutic massage also relieve the pain by the hand and the elbow. We give the massage to the patient who is the feel the discomfort and pain in the total body area. So also relieve the low back pain. At the time during the massaging, the endorphins hormones also release and relieve the pain. Here the anxiety, tension, depression all are will be relaxed. Anxiety will be relieved, tension will be reduced, depression also will be vanished, and it also can given the treatment during the arthritis condition also. ताले message condition को elbow hand use करके हमें व्यक्ति रो body पर हमें message करो message कले दला व्यक्ति जो discomfort feel करूची बा pain body होची ताहा relieve होई थाए केमिति होई थाए एथरे low back pain मध्ये relieve होई थाए आउ arthritis condition भलिया मध्ये arthritis condition जो pain होई ताकु मध्ये relieve होई थाए एथरे कोन होय ना endorphin से एक हार्मोन क्रिएट होय एवं ताहा पेन को कंट्रोल करथाए. नेक्स्ट कम तो ego is a mind body exercise that also help to the relax the pain and control your breath. So ego पद्धति रे कोन बा ये गोटे बॉडी माइंड एक्सरसाइज एथरे कोन होय ना बॉडी रो ब्रीथिंग लेवल टा मध्ये कंट्रोल होय थाए आ बॉडी को स्ट्रेंथनिंग बॉडी रे स्ट्रेंथ मध्ये आसी थाए यो माइंड रे मध्ये स्ट्रेंथ आसी थाए. ओके इट इंप्रूव द मोबिलिटी एंड फंक्शन रिड्यूसिंग स्ट्रेस promoting relaxation and reduce the joint related the pain. So ego is a body mind exercise by which we control our the mind, breathe and provide the strengthening to the body and relieve the emotional disturbances, emotional painful experiences, and it also reduce the stress, reduce the pain. Okay, then come to the acupuncture. Acupuncture it provides the stimulating sensory nerve stimulation under the skin and the muscle. Okay, that result in the body producing natural substance such as pain relieving endorphins. So in the acupuncture so acupuncture through by the acupuncture the sensory nerve responses or stimuluses are goes under the skin and the muscle by which endorphin like hormones are released, the pain will be relieved. So acupuncture it involves stimulating sensory nerve under skin and muscle by which producing the natural substance such as pain relieving endorphins. ताले acupuncture कोन होला ना acupuncture द्वारा कोन जेतले आमे बॉडी रे अप्लाई करले त सेंसरी नर्व इंपल्सेस गुडा को स्किन आ मसल अंडर को कंटिन्यू फ्लो हेले एवं जहा द्वारा कि कोन होला ना एंडोर्फिन लाइक पेन रिलीविंग हार्मोन रिलीज होला एवं पेन कंट्रोल हे परला. Acupuncture it involves the insertion of a very thin needle through your skin at the point on the body. So गोटे thin needle कौन करा जाए ना acupuncture रे pain area रे insert करा जाए जहाँ कि it will help to reduce the stress and treat the pain. Example in the dental pain also is used and headache in the headache such as the migraine case also be acupuncture needed. Next come the herbal therapy. In the herbal therapy also be it is a natural product by which the patient's pain will be relieved. In the herbal therapy we use the garlic, ginseng, eucalyptus, cloves etc. So these are natural painkillers or herbs or remedies. Another example is the lavender essential oil that is also helpful to the relief pain to help sleep to easy anxiety. So lavender essential oil madhya pain relief karibare help karthae. Okay, so see that these are the pictures of the tense, how tense will be applied in the body: ego, meditation, acupuncture. Thank you. So pain is your over. It is from the 14th unit. Okay, thank you.